Hello, everyone. This is Dr. Khan. I'm going to go ahead and go live, and so please bear with me. It's a pleasure to be on, and welcome to Executive Plastic Surgery. So I want to go ahead and basically expand on the many other aspects and facets of what is plastic surgery. Plastic surgery has a lot of procedures that we do. From craniofacial pediatric plastic surgery cases to burns, to basically big flaps for cancer or post traumatic reconstruction. For example, big wounds on the leg or the back. We do a lot of aesthetic cosmetic plastic surgery as well, with face rejuvenation, from fillers to lasers. And then we also do hand. Believe it or not, big aspect of plastic surgery is hand reconstruction. That in itself is a world in itself. So a lot of hand injuries. We as plastic surgeons manage the repair of nerves, tendons, bones. There are a lot of reconstructions that we do all over, including skin cancer, flaps after melanoma, basal cell, squamous cell cancer reconstruction. And from a lot of reconstruction such as this to breast chest reconstruction, especially after breast cancer or cosmetic enhancement surgery. So plastic surgery is a very involved field where we basically are trained to take care of a lot of problems. My mentor used to say it has almost 3,000 procedures that we can do. So I just want to go ahead and expand on, a big part of my practice is explant surgery, where I remove saline implants, silicone implants, and residual capsules. But I do certainly see and manage other injuries, especially when I started off. I did not do any augmentations, and I primarily focused on all the other aspects of plastic surgery, primarily focused on open wounds, chronic wounds, traumatic injuries. So, for example, a lady that fell and had necrosis of her skin at the level of the knee and below. And this is where I used artificial skin, which is basically Integra, which is the dermal regeneration template. It's made up of shark cartilage and bovine collagen, and that's what I used after debridement and washout for reconstruction. There are many dog bite patients, for example, animal bite patients that I've taken care of. There are a lot of hand injuries that I've managed in the past that we have been trained in, from lacerations to crush injuries to burns. Just yesterday in my clinic, there was an emergency that I had to see, and this gentleman was using the plasma cutter, which is a very hot beam that is radiated from a tool that's used to cut metal. And it can get anywhere from 3,000 to 10,000 degrees Celsius hot. And he actually ended up burning his hand. And he was emergently referred to me given the injury, the thermal injury and the burn. And these can be very complex cases. So to be able to manage such patients requires a lot of expertise and experience as well. So these are patients that I've taken care of. Patients with basal cell cancer, squamous cell cancer, melanoma as well. So a gentleman came to me almost 6 weeks ago, and he had a lesion around his eye. And it was not healing. It was there for many months, or almost 6 months. And so any lesion of the face that does not heal is, a big suspicion, red flag for cancer. And lo and behold, I treated it as such, and I cut it out with the appropriate margins, 2 millimeters, given the laxity of the skin that he had. And lo and behold, it did come out to basal cancer. So in my practice, whenever I remove any skin from any face or any part of the body, I go ahead and send that off to pathology to make sure it's not squamous cell cancer, basal cell cancer being the most common, or melanoma, which is the most deadly of the cancers. I want to go ahead and say, using this platform, when we see a lot of patients that get hand injuries. Let's go ahead and focus on that. So there was a patient, for example, that was cutting a pumpkin. And the first and foremost thing here is that you should not be using a knife, because The way the pumpkin is, for example, and you're cutting it, it will jerk, it will slip, especially the sharp knives, especially in the hands of the kids. You have to be very careful that you can get some of these cutting devices that are sold that are child safe, if you will. But the bottom line here is not to handle the sharp instrument. And if you don't have to handle it, you're going to cause the problem or the injury. And so this is prevention. An ounce of prevention is more than a pound of cure. And the most important thing here is another example, just to talk about hand injuries, because we all have had hand injuries, in our lives. The cut, if it involves a nerve, it must be and there is numbness and tingling, and it will be very direct. If that is the case, then that injury needs to be repaired within 24 hours or as soon as possible for the best results, because what happens is the nerve retracts and it requires a microsurgical repair so that the two ends of the nerves coapt, are brought together tension free. And just like two wires, if you will, are brought together after they're cut, they need to be brought together such that the nerve aligns perfectly well, so that you have the intact sensation that is certainly brought back to the finger. So the hand certainly can be very complex, and whenever there's a hand injury, there's a lot of function that needs to be preserved, and also aesthetics as well. And plus, you do not want a contracture that can potentially occur at the site of the injury. So whenever it comes to a hand injury, you want to be seen by a hand surgeon. So as you will see, if you walk into the emergency room with a hand injury, not even a general surgeon or a trauma surgeon or an emergency room doc is trained to manage hand injuries. That's why you have to go to the hand specialist, a hand surgeon, and they will be able to better take care of the hand injuries. So there's an urgency from the time you have the injury to the time that you're definitively taken care of, if this is an injury. So that gentleman that came in with that plasma burn, I saw him, assessed him, given the many thousands and probably tens and thousands of hands that I've seen. And this was an injury that was potentially very much manageable by non-surgical methods. I have already seen him twice, and he will get what is the expected management approach. Another injury was where the patient had a high pressure injection injury from oil that was injected into the hand that requires a debridement and washout. Compartment syndrome can occur, which means that the hand surgeon needs to see that patient. If there is a nail avulsion injury, that means, for example, many kids that have had their fingers that got in the door, be it the hinge part of the door or the other part of the door where you open and close, that nail avulsion needs to be managed sooner rather than later. If you have any open wounds of the hand with exposed bone, they certainly need to be managed. The other thing I want to talk about burns is we all have had a burn. The superficial burn is very similar to what is a sunburn, and usually within 7 to 10 days it resolves. The second degree type of burn is superficial second degree or deep second degree, and this is where the dermis is very much still overall relatively intact, even with the deep. And washout and debridement and cleanup of the wound usually is adequate. But if this is a third degree wound, that means the entire thickness of the skin is involved, then this certainly needs to be managed by surgical excision, removal, and approximation of good healthy tissue with the removal of devitalized dead tissue where there is no nerve endings, no oils that are present. And you want to have good skin with good nerve endings to be brought together and the dead skin removed and debrided. And this is where, again, a plastic surgeon needs to manage the injury. So this is, overall, if you look at the many burns, the many hand injuries, the facial lacerations that occur, be it the ear that's involved with exposed cartilage, or the nose with the exposed cartilage, or the lip laceration involving the vermilion border, or around the face or eye, this requires urgent, immediate attention by your plastic surgeon. Now, this is unfortunately what happens. And this is, again, we're trying to enhance the quality of care and to allow for basically better aesthetic result. In real life, what happens on a daily basis is, let's say if a kid is playing in the park and he falls and basically busts open the lip, or there is a dog bite that's isolated to the cheek, or a hand injury with a cut from a pumpkin, a knife cut, if you will, accidental, or cutting an avocado, also relatively common, or a burn. What happens, unfortunately, is the patients go to the emergency room, and the emergency room, you get seen by a nurse practitioner, PA, or the emergency room doc. And remember, they're not plastic surgeons. Their job is to refer you ultimately to a plastic surgeon who will be able to better manage you. They will give you the tetanus shot if you need it. They will make sure that you get the antibiotics right away. And they will go ahead and get you plugged in with a plastic surgeon so that you can get seen. Now, unfortunately, what happens is, especially if this happens on a weekend, what happens is that the patient is managed with nylon sutures. The patient is managed by a resident or a nurse practitioner or a physician assistant or emergency room doc. Remember, they are not plastic surgeons. With all due respect, their expertise is to make sure that they save lives. Their role is to, if someone comes in with a heart problem, that cardiologist gets to see the patient right away. If someone has abdominal pain issues, general surgery will come, or gastrointestinal GI team will come and assess. If someone is throwing up, they might give fluids. The bottom line here is, if you have a plastic surgery emergency, then you get referred to a plastic surgeon, and sometimes it's a day, 2, 3, 4, 5, 6 days later before you even get seen. So if that hand cut occurred and you're not able to get into a plastic surgeon's office, or a burn, or an open wound, or a laceration, or on the face, or this, unfortunately, what I have noticed in my practice is leads to an ultimate delay. So in my practice, what I have done initially, and this is where I'm expanding my practice, is you basically call the practice executive plastic surgery, and this is where I or another colleague plastic surgeon will attend to your emergency, hopefully the same day, if not the following day. And if you need any urgent surgical intervention, we have direct 24/7 access to the operating room, and literally you would get treated like the president, which means that you will get to the operating room right away. So this has happened many times, and I use the word thousands of times before, where a patient walked in with the fingertip amputation, and literally the finger was in a Tim Hortons cup with ice in it in order to basically keep it cold. And this is how the patient presented to me emergently. I was able to take him within a half hour to the operating room, clean the finger that was amputated, attach it, and this allows for the best recovery, less pain, overall preservation of the aesthetics, preservation of function, and better return to work, and no wait times. And this is where the best care is the one where you have direct emergency access care to a plastic surgeon, be it a dog bite, for example. Now, some dog bites, for example, can be really bad, where the puncture might involve the face or the eye, and you may need to get seen by ophthalmologist. This is where you have to go get seen at the emergency room, because they have 24/7 access to maybe an in-house ophthalmologist who might be a resident, who might be present. But if there's an isolated cheek laceration or lip laceration or a forehead around the eye, but sparing the eye, this is where you get to be seen right away by the plastic surgeon. You will get cleaned up and adequate anesthesia if you need light sedation, if you need to be intubated, if that is what is required to keep you comfortable, then that service absolutely can be provided, and you will be able to get instant, immediate access. And we have what is self-bundled pay packages, where you can get seen right away, emergently. And unfortunately, because of the way the insurances work, we do not deal with insurance. Insurance does not want to recognize or pay for anything or for any injury. Their unfortunate role is to make money at the expense of any opportunity they have and not to pay. And even when they do pay, if they do pay 3-6 months later, it's going to be a fraction. They unfortunately bundle. For example, if I have to repair a finger deep laceration that involves the tendon and the nerve and the skin, they will only pay for one of those procedures and not the three. And this is where they look for creative ways to not pay the surgeons. And as you know, in the world that we live in, given the time and amount of services that are offered, the insurances unfortunately are not paying the surgeons or any doctor, if you will, the amount that they deserve. So going back to the point, if you have any of these injuries, now there are a lot of patients, unfortunately, who have very high deductibles, which means that they have $7,500, $10,000 deductible, or even $5,000, and you have a bad laceration. You fear going to the emergency room because you feel like you will meet the cap, or if you go see your plastic surgeon, just getting the insurances involved in the operating room that will meet the deductible. So unfortunately, there are so many patients that I've seen in real life that have basically not opted to get surgical intervention because they thought they would not get injured. And now when it was time, they opted to save their credit history to not get the surgical intervention that they needed at the hospital. So for those patients that have high deductibles or no insurance, like the gentleman who had the lesion on his eye, he chose to pay out of his pocket. And this is something that was easily done under local. And it was excised and it was sent to pathology. And I have basically discussed with my pathology team that anyone who pays cash, they get like a very nice discount so that they're not paying an arm and a leg, and certainly to us. So if you go to my webpage, you will see what are the bundled prices, for example, for carpal tunnel. So another one instance was when I was operating, believe it or not, one of my assistants, he was having weakness and numbness of his hand and decreased grip strength and pain. And I told him, how come you do not go and get the carpal tunnel release? And he said his deductible was very high. I told him I would be able to do it for a fraction of the price in the operating room. And he certainly did seek that intervention. Another patient was one of my very close friends. She's a physician. Her father-in-law needed carpal tunnel release. And this is a patient who was already on Plavix, which is a blood thinner, because of the heart stents. And the patient had documented carpal tunnel syndrome on an EMG test, which is the nerve conduction study, which clearly showed that the carpal tunnel was the problem. What I did was under local, I did operate on him without anesthesia because of his significant cardiac risk. I was able to give him a median nerve block and also an effective block in the arm. Without the tourniquet, I did do the release of the transverse carpal ligament. And lo and behold, he did not need any intervention. And I was able to operate on him while he was on the Plavix. And I did so very safely. And he continued to do very well post-op. And he had full return of hand of range motion. I showed him how to do the physical therapy, occupational therapy, hand exercises, and he was able to go on and have the relief of the carpal tunnel. Cubital tunnel, patients with Dupuytren's contracture, trigger fingers, for example, any intervention that's needed. If you have no insurance or high deductible, a lot of Canadian patients, what is interesting about Detroit is you have Windsor that we look south on, meaning this is one of the only city in the US where when we look south into Canada. And so a lot of Canadian patients who have long wait times or no access to a plastic surgeon, they have certainly come to our market here in Detroit and sought relief, be it carpal tunnel, be it knee replacements, which obviously I don't do. But any of these procedures that you're looking for, you can certainly go, be it lesions, skin masses, old lacerations, cubital tunnel, hand injuries. And this is something that we are going to start offering. So no insurance, high deductibles, long wait times. We are here to offer you the relief that we can cater to, be it in the clinic or in our state-of-the-art Quad A, which is the certified gold standard operating rooms outside of the main hospital, which is the certified surgical facility that we have upstairs. So what I'm going to do next is, if you have any questions, any concerns, any specific questions in regards to any lesions, certainly feel free to reach our office here at Executive Plastic Surgery. We're located here in Bloomfield Hills, Michigan, and we certainly will be able to offer you any of the relief that you're looking for, and basically a very transparent, well thought out plan, such that when you do come, we identify the problem, if you need surgery or not, and if you do, what are going to be the surgical fees, all bundled into one, which is the consultation by the plastic surgeon, the surgical intervention if required, and all the post-op management as well, all bundled into one lump sum price, so that you get the quality care that you would instantly within a day, if not within 24 hours, and you get the best treatment, best results, best recovery, less pain, preservation of the aesthetics, and world-class care that everyone deserves. Hopefully you found this informative. Look forward to another Facebook Live, TikTok, YouTube Live in the next day or so. Thank you.